Hi guys, welcome back to my channel. This is Dr. Rajeshwar from yrpharmatube. In Anticonvulsants chapter, we discussed about the barbiturates in the previous video. If you did not watch the video, hit the I button on top right of this video to watch it. To watch the other topics of anticonvulsants and other subjects of pharmaceutical sciences, click on the links given in the description box below this video. In this lesson, we shall try to understand the second type of anticonvulsive agents, that is Hydantoins, and the individual drugs such as Phenytoin, Mephenytoin and Ethotoin. At the end of this video, you will be able to understand the Hydantoin type of anticonvulsant agents and the specific individual drugs of the class, which include Phenytoin, Mephenytoin and Ethotoin. Hydantoins are chemically known as glycosylureas. They are the oxidized derivatives of imidazolidine. Therefore, they have imidazolidine 2,4-dione heterocyclic ring system and are related to barbiturates in having a alpha-glycosylureide structure. Its IUPAC name is imidazolidine 2,4-dione or imidazoline 2,4-dione. It was first isolated in the year 1861 by Adolf von Baeyer in the course of his study of uric acid. He obtained it by hydrogenation of allantoin, hence the name Hydantoin. It is a colorless solid that arises from the reaction of glycolic acid and urea. One of the earliest Hydantoins to be tried as anticonvulsive agent was 5-ethyl 5-phenyl Hydantoin, which was also called Nirvanol. It had structural similarity with phenobarbital. It was found to exhibit broad anticonvulsant activity but was too toxic for general use in epilepsy. In 1908, H. Blitz had synthesized 5,5-diphenyl Hydantoin, but its anticonvulsant activity was not discovered until 1938 by Putnam and Merritt. The same year, Phenytoin was introduced for the treatment of epilepsy and till date remains one of the most effective anti-epileptic drugs. The remarkable property of Phenytoin was that it was not sedative in ordinary doses, which established that antiseizure need not induce drowsiness. This encouraged the search for drugs with selective antiseizure action. The most important drug from Hydantoins class is Phenytoin. It is a very potent anti-epileptic drug and can be used in several types of epilepsy. It is one of the most important anti-epileptic drugs available. A significant advantage of Phenytoin is that it produces little sedation. Phenytoin is a weak acid with pKa of about 8.3. Mephenytoin, Ethotoin and Phenytoin are other Hydantoins of the class. Mephenytoin is the N3-methyl analog of Nirvanol. It is less toxic than Nirvanol, but it is N-demethylated metabolically to Nirvanol. Unlike Phenytoin, Mephenytoin is rapidly absorbed after oral administration. Both the parent drug and its N-demethylated metabolite are converted to inactive hydroxylated products. Mephenytoin was introduced for clinical use in 1945. Because of its potential toxicity, it is not commonly recommended drug for epilepsy and is given only to patients unresponsive to other treatment. Ethotoin was introduced in the year 1957. Due to its low efficacy, it is used only occasionally in the therapy of generalized tonic-clonic seizure, mostly as an adjunct to other agents. Phenytoin is a more soluble prodrug of Phenytoin that is administered by intramuscular or intravenous injection. The most important member of Hydantoins is Phenytoin. Phenytoin was first identified to have anti-seizure activity in the year 1938 and it is the oldest non-sedating drug used in the treatment of epilepsy. Phenytoin was approved by the FDA in 1953 for use in seizures. Its IUPAC name is 5,5-diphenyl-hydantoin or 5,5-diphenyl-imidazolidine 2,4-dione. It is an imidazolidine 2,4-dione that consists of hydantoin bearing two phenyl substituents at position 5. In other words, it is the 5,5-diphenyl substituted analog of hydantoin. It has a role as an anticonvulsant, a teratogenic agent, a drug allergen, and a sodium channel blocker. Phenytoin is a hydantoin derivative and a non-sedative antiepileptic agent with anticonvulsant activity. Phenytoin was first synthesized by German chemist Heinrich Blitz in 1908 and found useful for the treatment of seizures. It is synthesized in three different methods. The first method involves by heating alpha-bromo-diphenyl acetylurea with alcoholic ammonia forms phenytoin. The second method involves a rearrangement on the reaction of benzyl with urea to form the product phenytoin. The third method involves the reaction of benzophenone with sodium cyanide in the presence of ammonium carbonate, followed by the simultaneous cyclization of the resulting product, that is carboxyaminonitrile, and its rearrangement under the reaction conditions to form phenytoin. Phenytoin appears as a fine white or almost white crystalline powder. It is odorless or almost odorless and tasteless compound. It has melting point between 295 and 298 degrees centigrade. It is soluble in cold water, soluble in acetic acid, slightly soluble in ethyl ether, benzene, and chloroform. It is sensitive to light, and when heated to decomposition, it emits very toxic fumes of nitrogen oxides. The mechanism of action of phenytoin and other hydantoins is complex and affects the activity of both neuron ion channels and neurotransmitter functions. The primary effect of phenytoin is believed to prolong the activation of period of sodium channels in the nerve membrane. The result is a reduction in generation of the high-frequency repetitive firing of action potentials from neurons involved in initiating seizures. The figure shown here is the comparison of normal brain waves with the high-frequency repetitive firing of action potentials observed during an epileptic seizure. Phenytoin is marketed under many brand names worldwide. It is sold under the brand name Dilantin. It is an anti-seizure medication. It is useful for the prevention of tonic-clonic seizures, also known as grand mal seizures, and focal seizures, but not absence seizures. It can be taken intravenously or by mouth. The intravenous form generally begins working within 30 minutes and is effective for roughly 24 hours. The next drug is Mephenytoin. Mephenytoin is an anti-epileptic agent and belongs to the category of phenylhydantoins that are heterocyclic aromatic compounds containing an imidazolidine dione moiety substituted by a phenyl group at C5. It is a hydantoin derivative anticonvulsant used to control various partial seizures. Its IUPAC name is 5-ethyl-3-methyl-5-phenyl-imidazolidine 2,4-dione. It is an imidazolidine 2,4-dione, that is hydantoin, in which the imidazolidine nucleus carries a methyl group at N3 and has ethyl and phenyl substituents at C5. It has a role as an anticonvulsant agent. Mephenytoin and oxazolidine dione derivatives are associated with high incidence of blood dyscrasis compared to other anticonvulsants. Mephenytoin occurs as solid crystals and has melting point between 135 and 137 degrees centigrade. It is practically insoluble in water. When heated to decomposition, it emits toxic fumes of nitrogen oxides. It forms a water-soluble sodium salt which has an alkaline reaction. The mechanism of action of Mephenytoin is not definitely known, but extensive research strongly suggests that its main action is to block frequency, use, and voltage-dependent neuronal sodium channels and therefore limit repetitive firing of action potentials. It has almost the same mechanism of action with that of other hydantoins. Mephenytoin is marketed as Mesantoin by Novartis company. As an anticonvulsant, it is no longer available in the United States and in the UK. It is used in the treatment of refractory partial epilepsy. As an anticonvulsant, it is effective in tonic-clonic epilepsy. And the last drug in this class is Ethotoin. Ethotoin is a Hydantoin derivative and anticonvulsant. Its IUPAC name is 3-ethyl-5-phenyl hydantoin or 3-ethyl-5-phenyl imidazolidine 2,4-dione. Ethotoin is an imidazolidine 2,4-dione that is hydantoin substituted by ethyl and phenyl groups at positions 3 and 5 respectively. Ethotoin is less effective and less toxic than phenytoin. Ethotoin is synthesized by the reaction of benzaldehyde oxynitrile with urea or ammonium bicarbonate, which forms an intermediate urea derivative which on acidic conditions cyclizes to form 5-phenyl hydantoin. Alkylation of this product, that is 5-phenyl hydantoin using ethyl iodide, leads to the formation of ethotoin. Ethotoin occurs as solid stout prisms from water. It has melting point at 94 degrees centigrade. It is sparingly soluble in cold water, more soluble in hot water. It is freely soluble in alcohol, ether, benzene, dilute aqueous solutions of alkali hydroxides. Ethotoin darkens on exposure to light or extreme heat. When heated to decomposition, it emits toxic fumes of nitrogen oxides. Ethotoin exerts an anti-epileptic effect without causing general CNS depression. The mechanism of action is probably very similar to that of phenytoin. Ethotoin was previously marketed as Peganone. It is an anticonvulsant drug used in the treatment of epilepsy. It is a hydantoin similar to phenytoin. It is not available in the United States and no longer used commonly. It is taken orally in 4 to 6 divided doses per day, preferably after food. This is the list of references followed for the lesson. That's all in this video. The hydantoins, a second type of anticonvulsants, and the individual drugs phenytoin, mephenytoin, and ethotoin. In the next lesson, we will discuss about the oxazolidine dione class of anticonvulsants. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.